Okay, good afternoon, everyone. Thank you for joining us for the second OBH Lunch and Learn series on mental health matters. My name is Sharon Lead. I'm the Director for External Affairs at One Brooklyn Health, and we are just happy that you are able to join us and see and learn more about what mental health services are out here in the community, in the Black and Brown communities, and just all over. And I'm happy to introduce our panelists. OBH, we see it as very important to create an honest conversation about mental health in this community. So I'm really glad that everyone is able to join us today. And thank you to our panelists. Before I introduce them, I just want to just give a little information. So for long, mental health has been pushed aside, normalized as something to endure. While resistance is part of who we are, silence should never be at cost. Mental health mental health is health, and it deserves the same care and attention as our physical well-being. This afternoon, we're going to be talking about signs, recognizing signs, understanding resources like 988 and the Mobile Crisis Unit, and what mental conditioning means in building emotional strength. Most importantly, we want you to know that support is available and One Brooklyn Health is committed to walk alongside our community. Just a few house rules that I would like everybody to know about. If you have any questions, please either put it in the chat box or in the Q&A box. If you cannot use the chat box or the Q&A box, please wait until the end and then raise your hand. Or when I ask if anybody has any questions, I will be able to take you off mute and bring you to the stage so you can ask your questions. But we will want to make sure that our panelists are able to give their information, their expertise in a full manner so we're able to let everybody know. So let me introduce our panelists today. So today we have Mr. Elliot Allen. He's the founder and trainer of the Mental Conditioning Movement, as well as an author. We also have Dr. Tula Olupona, who is the OBH Program Director and Behavioral Health Program for the Behavioral Health Program. And then we also have Sonia Davy, who is a New York State licensed mental health counselor and also the founder of Sonia Davy Wellness LLC. Thank you so much, everyone, for joining us today. This is a very hot topic. It has been hot for many years, but it is now more coming to light that our communities are now embracing mental health and embracing services that you all provide in a much more vibrant way. So I'm going to ask for the first question is going to be for Dr. Olupona. What are some of the common signs and symptoms of mental health challenges that shows up in Black communities, and why are they often overlooked or normalized?
Thank you so much, Sharon, and thank you for having me for this presentation. And a big thank you to my co-panelists that are here this afternoon. So in our community, a lot of times the presentation of mental health disorders is not like the typical presentation that we're used to. Oftentimes there are patients who will present with the classic presentations of various disorders. However, our community faces some unique challenges that also makes presentations very unique. As you are aware, we go through a lot of racial stress, a lot of economic pressure, and oftentimes there is a pressure to sort of stay strong and resist, as you were talking about. And for that reason, patients sometimes may feel more comfortable, or they express their mental health symptoms more with physical symptoms than with emotional expression of distress. So you may have a patient who is presenting for depression, and as opposed to coming in saying, I'm feeling sad and down, they may be more likely to say like they're feeling tired, they're exhausted, they're going through it, versus naming it as, the sadness that we often see in typical presentation. Also, sometimes when patients have anxiety issues, their anxiety symptoms may present more with physical symptoms like heart racing, headaches, stomach aches, as opposed to just often the cognitive worries that patients sometimes may come into. And if you're not, on alert, you may miss it because they oftentimes will present more with the physical symptoms, and they may actually end up going to primary care doctors first before they come to see us. There's also a lot of use of marijuana and alcohol as a way to self-medicate and cope. as a way to unwind from stress and pressures that people are going through. And as you know, sometimes as the ongoing marijuana use and alcohol use continues, it may actually lead to substance use disorder because there hasn't been an alert that this is going beyond unwinding and
Mhm.
normalization of use of alcohol and marijuana as a way to cope with problems. So these are some of the things that we see sometimes that may make the presentation not look as classically as we often expect.
Mhm.
Okay, thank you. And I'm going to pass this on to Sonia as well. I'll repeat the question again. What are some of the common signs and symptoms of mental health challenges that show up in Black communities, and why are they often overlooked and normalized in the work that you're doing? So you are a licensed mental health counselor. So you work with a lot of people one-on-one, not in a hospital setting, if I'm not mistaken, but you work with. So what is your take on some of the signs that you see?
Well, some of them is stress because a lot of times people are coming in with a lot of chronic stress and they're not realizing that sometimes that the stress that they have is not that simple, that it may be tied to post-traumatic stress disorder. It has so many layers to it. And so a lot of times when they're just coming in or they're just discussing stress, there's a lot of other mental health issues that may be, or traumas that may be attached to it. A lot of the, as the doctor said, a lot of health issues people aren't recognizing are sometimes fueled by mental health issues. And one of the big ones, believe it or not, is like diabetes, because so many people in our community have diabetes, but also for some of them, they also have histories of trauma. And they don't realize that over time, when the body has been hit so much with the trauma or is not been dealt with, that they are now having something that manifests as diabetes or other autoimmune issues. And then when you start peeling back the layers and asking a lot of questions, you realize, oh, this person may have a trauma history. Another thing we have a tendency to do in our communities, we over spiritualize a lot of things. So a lot of times if there's a person is feeling down, just like some of the symptoms Dr. Olapuna said, whether they're tired, fatigue, or they're worrying a lot, they will just over spiritualize a lot of things that really need a mental health professional to help them to, understand what's really going on with them. So those are a lot of things. Oh, and also anger. We've normalized anger and rage as that's just how we function or that's just how Black people are. When no, a lot of times their anger and people constantly, again, where they're again, just constantly dealing with a lot of rage and anger as a way of responding to everyday incidents, it's sometimes attached to um, a deeper dive that needs to be looked at in terms of their mental health.
Thank you so much. I mean, both of you had mentioned something in terms of like with substance abuse and also with diabetes. So you're taking medication as well. Can some medication lead to mental health issues?
There
Diana.
Yeah, a lot of medications may have side effects that have lots and lots of medications. And that's stuff that we deal with. Famously, there's retinoic acid that people use for like acne, for example, and it could cause depression. But so our colleagues in the field of dermatology, they're very, very familiar with that. There are antibiotics as well. So there are a host of medications can have mental health consequences. Propanolol that we use for sometimes for hypertension can actually have a side effect of depression. So those are the things that we kind of study so that if you're prescribing some of these medications, our colleagues are aware of those of them who are not psychiatrists, who are maybe in the internal medicine, primary care, rheumatology. They're aware of some of the side effects that may have more of a psychiatric presentation. So lots of medications can do this.
And one thing I want to add, absolutely, polypharmacy, which is an issue where sometimes people are prescribed too many medications. So if you have someone that's on 4 or 5 medications and there's no one really gatekeeping and managing all of these different meds that people are taking, that can also be problematic as well. And they're not also just psychiatric medications, it could just be a lot of medications that are not just, one person sees different doctors and they're not all being properly managed.
So in
Yes.
other words, if you're using any type of medication, you should definitely try to look at what the side effects are and speak with your primary care and your
Speak with
mental
your
health
doctors.
counselors and speak with the doctors to see how this can help. So everybody can just work in sync together.
Exactly. I have all the doctors. I believe I try to tell clients that have to take other medications for their health. Make sure that everyone, all the doctors are communicating on some level, make sure that that's happening so everyone knows what's going on.
Great,
Now,
great. And before,
a lot of the doctors, when they do prescribe these medications, are aware of these side effects. So, at the primary care visit, if the patient is showing, they should let them know that there is a potential, possibly psychiatric complication with this medication, and they should give patient handouts. And as you said, the patients themselves at home can also do their own research and review all the side effects of their medicines to see if there's any sort of emotional sequelae that could come from a medicine that they're taking. Yeah.
well, this seems like this particular topic seems like another series that we need to have, because it seems like we could go on and on about this. But before I go into the next question, I want to introduce our next panelist. Thank you so much, Dr. Nichols, who is the One Brooklyn Health Mobile Crisis Unit Program Director. And, thank you so much for joining us. Our next question is actually Dr. Olapuna and Dr. Nichols. This is for you. What resources are currently available for individuals and families seeking mental health support? And how can people access help without fear, stigma, or judgment? And I'm going to actually pass this on to Dr. Nichols since she just joined us.
Morning, everybody. Sorry, I was a few seconds late there. Since I work on a mobile crisis team, I'll start with that. New York City has a large mobile network that they use to help people suffering from mental health issues. The mobile network includes intensive mobile teams, ACT teams, mobile crisis teams, as well as why am I blanking? Be Heard, the co-response team, and have I covered all the mobile teams? Those are, but it's a very extensive and a large group of teams that are out there. I don't know how much time I have, so do you want me to describe each of those or explain them, Sharon, or?
No, I mean just briefly give, because want Dr. Olapuna also to give give her point of view in terms of what are some of the services coming from which she works with her program director for
Okay,
the
so
help.
those are the mobile teams, and then since I'm at Brookdale Hospital, Brookdale has inpatient units for child and adults, and it has an outpatient unit for child and adults, and we have a psychiatric emergency room, what we call a CPEP, for children and adults. Those are the main services that Brookdale Hospital offers out in the community. And besides the mobile crisis team, the mobile crisis team does go out to the community. That's where we find our patients. We don't see our patients here at the hospital. We go to your home, we knock on your door. And yes, we come Christmas Day, we come Thanksgiving. When you don't want us to come is the moment we will show up. We are 365 days a year, 7 days a week from 8 a.m. to 8 p.m. Most of the mobile teams have those hours, I would say, except for the co-response is till 1 a.m., I think, or 11, and the Be Heard program is until 1 a.m. So nothing's fully 24 hours in the mobile teams.
And Dr. Olapuna?
Yes, so at Interfaith, I guess I'll start with our acute services. If a patient is having a psychiatric emergency and they need to be seen acutely, they can come to our psychiatric emergency room. And there's always a doctor there 24/7 that can do an emergency psychiatric evaluation of the patient. Now, when a patient needs much more longer term acute, what we call acute stabilization, we have inpatient units where patients can stay for much longer, again, 24/7 monitoring of the patients while they're on our units. We actually have 2 of such units at Interfaith. They're 24 beds each. Now, for patients who don't need acute stabilization, we provide care also in our outpatient clinics. At the outpatient clinics, we have psychiatrists, we have psychologists, we have social workers that could do psychiatric evaluation if someone needs medication or provides psychotherapy. Now, if someone is an outpatient, but they also need more care, more intensity, we have an intensive outpatient program where patients can actually come multiple times a week for both groups and therapy, and also getting their psychiatric management. So a little more frequent than the typical outpatient visit. Now, if someone is in the community and they need they're in crisis, there is the 988 number that someone can call. 988 is 365 days. They're available 24 hours a day. There's always a provider that can provide sort of brief counseling. And it's not just for if someone is having suicidal ideation or things like that. Even if someone's going through emotional crisis, there's always someone that can speak to the patient or the client within a few minutes, and they'll pick up the call. Another organization that folks should be aware about is also NAMI, the National Alliance for the Mentally Ill. It is one of the largest advocacy group that we have in the country, very powerful organization. They have one of their offices in Manhattan. I've been there. And what's unique about this resource is that it's patient run. So if you log on to their platform, there's always during the week patient-led sessions to educate about various mental health disorders and give support to patients and their family. They also do a lot of advocacy work in the larger community. There's also the Depression and Bipolar Disorder Support Alliance, DBSA, another powerful organization for individuals who have depression and who have bipolar disorder, also peer run. So if you go on their platform and you want to be in a peer group for people with depression, people with bipolar disorder, they have various groups available, often virtual. And the good news is they actually have some groups, especially for Black folks as well. So if you want to be with a group just for people from your community alone, they have those groups virtually. So those are some resources that are out there if someone needs help. Obviously, if it's something that's acute, we need acute stabilization, bring the patient to the hospital, bring them to our psychiatric emergency room, whether at Interfaith, whether at Brookdale, 24/7, they will be evaluated. And if you're at home and you need to talk to someone urgently, we also have the 988 number. So there's a lot of resources available out there.
Can I just jump in? Sorry to just piggyback off of Dr. Olapana. Excuse me. I happen to have a 988 pamphlet, and as you may or may not be able to see, but they have every language imaginable. Oops, it's not working like I hope. They have every single language imaginable. I mean, you can call them in whatever language you speak. I think there are 800 dialects here in New York City, and they cover pretty much all of them. So obviously the main ones are easier to get responses, but they will find someone to speak to you. The texting and chatting is important for adolescents and children to know about because they prefer the texting and chatting than actually talking to someone. And that is the single point of access of how you get a referral to a mobile crisis team. So I'll talk more about mobile crisis teams after, but that's how you make a referral to mobile crisis team is through 988. And then to just add what Dr. Olapana was saying about NAMI, NAMI is phenomenal. I've had family members go to a NAMI training. There's free trainings for family members, whether you're a grandparent, a child of someone who suffers from mental illness. And that person, they can do a 6-week course. I've had people come back here to thank me for sharing the program with them because it opened their eyes that they weren't alone. They found supports. They understood more about mental illness. It was really mind-blowing what they had to say for that program. And as Dr. Olapana was saying, obviously the difference between a PsychED and a CPEP is really just nomenclature because people heard me say the word CPEP, which stands for Comprehensive Psychiatric Emergency Program, which is at Brookdale Hospital. And to have a CPEP, you have to have a PsychED, mobile crisis team, and something called extended observation beds, where someone can stay up to 72 hours to be further assessed to see if they should be hospitalized or they can be released back into the community for longer term services. So I just wanted to add to what Dr. Olapana was saying.
Thank you so much. And also at the end, I'm going to probably have you give the acronyms again for NAMI and also maybe the website. So just prepare to, to give that so we can make sure that we can let folks know to get access to that. But you can also get access to that if you feel that you have any one of these type of mental health symptoms, that you can always come to the Interfaith, the One Brooklyn Health Interfaith Emergency Room or the One Brooklyn Health Brookdale Campus Emergency Room, and then you'll be able to get assessed that way. Going into our next question, thank you so much, Dr. Olapana and Dr. Nichols. Our next question is for Mr. Elliot Allen. We hear the term mental conditioning more often now. What does mental conditioning mean? when it comes to mental health, and how does it support emotional strength, resilience, and healing?
Thank you, Sharon. Thank you for having me on here. Thank you for all the participants that have shown up. I always get excited to have an opportunity to be able to speak about, mental health. It's very, very important. And to answer your question, mental condition is a term that I'm very proud that we're actually hearing that term a lot more because it is much needed. But now we got to get into the importance of that term. Why are we using it? Why is it becoming more prevalent? I could talk about that for the next 6 hours, but we don't have that much time. So I'm going to get into it as quickly as I can and just give you some quick words. There's a word I'm going to throw on the table that's very important, and that word is understanding. And the second word is mindset. It's very critical that we have to understand how important our mindset is to our everyday living. I'm the third speaker or fourth speaker that went on today, and there's a lot of terms that have been thrown out there. In a nutshell, the process of mental conditioning is training our minds for, here comes another big word, write it down, it's a very simple word, but for clarity. That is critical to our forward progress. I wrote down some notes here. You've heard words thrown out there like anger. You've heard words thrown out there like rage. We talked about trauma, marijuana, medication. Listen, all of these terms, let me slow it down. All of these terms are a big opponent to our clarity. You cannot move forward when you're unclear due to rage, due to anger, due to trauma. The process of mental conditioning is the process of training our minds for clarity. There are certain things that we do in the mental conditioning gym, as you can see here, that give us that clarity. I always get excited and what's the right word? Really pumped up when I have the expertise on these panels with me because they're throwing out a lot of terms. But one of the things that I do in the mental conditioning gym is that I try to bring clarity to it because you guys have to understand, all your attendees that are on here, a lot of this is what we're gonna get very transparent and call it like it is. A lot of us don't want to admit any of those terms that the doctor said today. Nobody wants to say I have that. Nobody. And so the excuse behind that is I'm not clear. I don't know what that means. Oftentimes people come to my gym, people are training with me. You know what they say? That ain't me. That came up, and knocked on the door and come and, hey, sir, what's going on? I don't know what you're talking about. That's not me. The clarity part is conditioning your mind to understand, hold on a second, that might be me. So when we train our minds for mental conditioning, when you hear that term, I want everybody to replace that with the word clarity. Everybody, the 27 participants, the 5 panelists, we all go through moments of non-clarity. How do you train your mind? Hence, mental conditioning to bring that clarity back into your lives. Very, very, very important. Not an easy process. I broke that down in about 5 minutes because Sharon gonna be like, next. But I want everybody to be very clear about that. There's a lot of work that needs to be done to gain that clarity. There's a lot of work that we do here in the mental conditioning movement, here in the mental conditioning gym, to be able to get that clarity. I'm going to give it to you, put it on the table real quick. We train off of 4 principles in the mental conditioning gym. The first principle is self-evaluation. Very hard. Just spoke about that. And being able to assess, hey, something's going on with me. I understand. Who wants to admit that? I did a message this morning to say, I'm wrong. There's certain times you're wrong. Who wants to admit that? Nobody. Principle number 2, decision making. That's critical. I got to make a decision. I got to go see Dr. Olaponi. I got to go see her. Who can make that decision? Number 3, big picture. When you understand the big picture, my kids are the paramount thing in my life right now. So I got to be right mentally to be able to push forward. And number 4, stay the course. I promise you, we will all get knocked down. Who can get up and stay the course? But you need to have clarity to understand, why is it that I have to get up and I have to continue? I'm going to stop.
Okay, wow. Thank you, Mr. Allen. Couple of things that what I would like to just, talk about in terms of with the mental conditioning and with our therapists is that clarity means a whole lot. That's the first step in order for you to say, I need to go to Sonia Davy. I need to go to Dr. Olapuna. I need to go to Dr. Nichols. When you understand your clarity and when you understand your self-evaluation, that is a point of time where you're saying something is wrong. right? And that's where Elliot comes in, because you may not think something is wrong, but something is wrong, right? You know what you know. So at that moment, you go to somebody, you go to Elliot Allen with the mental conditioning movement, and then he brings you down to all of these things. And then the analysis is that, hey, wait a minute, we got to get you some professional help. We got to get you into somewhere, because this is very serious, and this can be long term lasting if you do not touch it or you do not work on it immediately. So thank you so much for that, for those 4 points, Elliot. Our next question is for actually Dr. Olapuna and Elliot. Is prioritizing mental health becoming part of the norm in our community? And why is it so important that we continue to normalize therapy, counseling, and mental wellness conversations? And I'm going to pass this over to Dr. Olapuna first, and then you, Elliot.
Mm-hmm.
Yeah, I will say that since the pandemic, I think we've seen a shift in people talking about mental health issues more than before. As you guys remember, during the pandemic, we had an explosion of depression, anxiety, substance use, domestic violence, and everybody was sort of, doing social isolation. And I think the conversation exploded during that period, and I think it's continued since then. I think also in the past few years, we've also had a lot of celebrities and public figure types that have been open discussing their experiences with mental health or going to therapy. Charlemagne the God, for example, the radio DJ, talks about going to therapy all the time. Ali Berry has also talked about her difficulties with depression. So I think having more public figures discussing their experiences, as I think brought more awareness that these issues are very common and people are seeking help. Also, I think with the explosion of social media in the past few years, particularly with the younger generation, with the Gen Z and the millennials, they are not afraid to go on TikTok or or YouTube or Facebook, Instagram, discussing their experiences with mental health issues and what's helping them with recovery, and they're being more open about it. And I think that's a really good thing. Because as we know, a lot of young people are online. And I think the more that they hear other people talking about it, the more it brings the stigma down. Also, the explosion of tele platforms for provision of mental health care. If you go online, you'll see ads for all these telehealth services where people can get therapy through video, like Talkspace, Talkiatry, all kinds of them. There's a lot of them. I think it's also making people realize that help is more accessible. That even if they don't necessarily want to come to the hospital to see us, they have these kind of platforms out there that they can use to see people. Not to say we don't have tele services at One Brooklyn Health as well, which we also do. So I think a change in culture with people talking about mental health on social media, knowing that they can get services now online, celebrities talking about it. I think all of that is coming together to sort of increase the conversation about mental health, which it's something I'm very, very happy about because we've been dealing with this for years, but now to see people talking about this, it's a good thing. And as you know, our mental health is crucial for our overall well-being. We know mental health affects our social functioning. It affects how we show up at work. It affects how we show up in our relationships. It affects our physical health, right? So it is essential for our well-being. And we also know that the earlier we catch various disorders and we can put intervention in, the more we can prevent things from getting worse. So the more we talk about it and people come to see people like myself and my colleagues here sooner, the better it is for better outcome in terms of whatever they're also dealing with. And also just in general, we want to bring the stigma down, just as you said, Sharon, regarding mental health disorders, so that people feel as comfortable talking about it as they feel comfortable to talk about hypertension and diabetes. So I think we're in the beginning of that, and I think it's an exciting time for those of us doing this work.
Absolutely. And Elliot?
Yeah, definitely. I have two pieces to that, and to really, back up what Dr. Olapone said. I think that we're living in a day and age where, and I say this all the time when I speak, I think we're living in a day and age where everyone knows about mental health. Everybody's a lot more aware of it. So that's good. I'm excited about that piece. But then there's a piece that I'm going to, again, be very, very transparent. And I'm going to push hard on it, and I'm not going to stop. There's an area that we have to get better. And I'm going to change the word of know to understand. We're not quite understanding the importance of our mental health. We're not understanding the importance of making sure that our mindset is right. Dr. Olapone, she said, it affects everything of our lives. Our mindset affects everything in our lives, relationships, listen, you driving in the car. If your mind ain't right, you driving in a reckless manner. When you get to work, you want to be effective. If you're a parent, you want to be as effective as possible. In a partner, in a relationship, you want to be as effective as possible. All of that has to do with our mental health, but we're not understanding that piece. And I get it. I get it. You talk about culturally, that's not something that we talked about in our homes. That's not a matchup that we were taught. That your mind ain't right. That's kind of like why you're off. But that's where I go back to that word about clarity. We're losing clarity because we're not understanding that I'm stressed out about whatever it may be. And we can go on for days about different things. We put those verbs that we was on the table earlier: anger, rage, trauma, even down to medication that we're taking sometimes got your mind going in a different direction. Like, what's going on here? But we're not matching that part up. That's the piece that I say, substitute the word know for understand. You have to understand that part of your lives has everything to do with your mindset. I'm going to give everybody a very quick, very, very brief exercise, but it's a very important and very powerful exercise that I want you guys to do. And if you understand what I'm telling you, what I'm about to tell you right now, this will stick with you for the rest of your life. I promise you. Where we are right now, there's 31 people. I keep looking over here. There's 31 people participating in this. We got 5 people on the panel. Everybody is here right now because of their mindset. Everybody took the time during the course of this day to get on this call because of their mindset. But I'm going to challenge everybody a little bit further. During the course of this day, today, tomorrow, next week, next month, next year, I want you to stop during the course of the day and say that to yourself. I'm standing where I'm standing. I'm sitting where I'm sitting. I'm laying where I'm laying because of my mindset. And look at where you are. Believe me, if you understand what I just said, that's a very powerful thing. I know I'm not perfect. And there's moments where I'm like, oh, I ain't supposed to be right here. But I got to check that. And there's times where I'm like, oh, this is exactly where I want to be. Right now, this is exactly where I want to be. But I'm only here because of my mindset. Mm-hmm. And so when you understand that piece of the puzzle, that's when it starts to really change. Because if it ain't right, that, I'm often saying this, and I'm often in the spot that I ain't supposed to be here. I know something's going on. Got to call Dr. Nichols. I got to go see Sonia. What the hell? I give it a try. Go see Elliot. Whatever. But this is the pieces of the puzzle that we have to really start to match it up. So to answer your question, Sharon, of course, we're here today. So I'm excited about that. But there is work to be done. I'm not satisfied where we're at in terms of understanding how important our mindset and our mental health is. I'm not happy with it. I'm going to be very transparent about it. I am happy that we're getting better, but let's get to work. Let's get into the mental conditioning gym and let's train. I use the parallel of mental and physical training. Physical is the same way. If you don't want to go to the gym, you ain't going to be in shape. You can't run that marathon. We got to make sure that we're in shape. There's so much stuff that's going on in our society right now is out of control. But at the same time, I challenge everybody to tell you the way to be able to combat a lot of this stuff that's happening out here, to be in shape up here. I promise you, you will go to a different level. So yes, I'm happy with, the progress, but we can get better.
Thank you so much. And you said 2 things. One is the understanding, right? Mm-hmm. So if you understand that there is something going on, you know that you can go to and get help. The other thing is consistency. So once you make that leap, and now you are in the mental conditioning movement, the training, or you're at Dr. Olapone or to Sonia Davy or to Dr. Nichols, you have to be consistent. This
Mhm.
isn't a one-off. This isn't something where you're going to go for 1 month and that's it. Oh, I'm cured. No, this is something that is an ongoing process, consistency. So I know with everyone here, all of our panelists, they urge everyone to make sure that once you make that commitment, it is a commitment. And everyone that is here listening, just understand that mental health is not something where you take a pill or you do something, whatever, and you're cured. It is a process, it's a journey, it's a movement. And this is why we're here talking about it so we can bring more awareness to everyone about this. And we're going to talk about the mobile crisis unit a little bit more, Dr. Nichols and Dr. Olapona. You mentioned briefly about what the mobile crisis unit is, but if you can just get a little bit more in depth with that, as well as when it should be activated. I know you mentioned the 988, but how is it being supportive to individuals experiencing a mental health crisis? And is the 98 and the service that 988 is connected to, and how do they work in conjunction with?
So, as I started before, mobile crisis team is one of the many types of mobile teams that you have in the city of New York. Our mobile crisis team, there's 24 teams in the city, adult and child. Some are just adult, some are child only. Child being up to the age of 21, meaning 20 years and 11 months. The child teams will go into the schools within 2 hours, and they will do an assessment in the school, and then they will continue with further linkage to services and stabilization at home with the parents. So that's a purely child team. Brookdale Hospital has a child and adult team, but our children only come internally because we have we have a child inpatient unit and a child psychiatric emergency room. So we don't get 988 from children, for children. We just get 988 for adults. 988, I'm going to jump around a bit, is, like I said before, how we get the single point of access is how you make a referral anyone from outside of the hospital. So if anyone internal to the hospital wants to make a referral to the mobile crisis team, they can do so. I can send them the paperwork, how to put in orders in Epic, and you can make an internal referral. So it can come from ophthalmology, labor and delivery, radiology. Dialysis often sends referrals because people with kidney disease often suffer from depression. So those are internal referrals, but everyone else outside of the hospital or the OBH system, in other words, Interfaith and Kingsbrook Jewish are also part of the OBH system. They make internal referrals. Everyone else would make a referral through 988. So 988 used to be the suicide hotline worldwide, countrywide, and now it is the new 911 for mental health. So when you dial 911, they'll say, do you need NYPD, FDNY, EMS, or mental health services? And so you say, I need mental health, they'll refer you to 988. What you have to understand about 988, it's not like 911. 911 knows my feet are here in New York City versus 988. If my zip code is 202, for example, Washington, D.C., it will go to the 988 counselor in Washington, D.C. The 988 counselor will do a triage, an assessment to see that you're stable, and then transfer you to the New York 988 counselor to connect you to services or to call 911 or whatever has to happen. So be very clear, 911 knows where my feet are. I'm in New York City, 988 might think I'm in DC. So that's one thing. But 988 is, as we mentioned before, 24/7. They often try to do a warm handoff. Their goal is not to go to the extreme, like, mobile crisis is the next level up. Their goal is to try to connect you to services. I use 988 all the time. They have a phenomenal database of information. So if you're looking for someone who has Blue Cross Blue Shield, boys group with purple hair, I make that up. They type it up and they will try and find it for you. So anybody who's out there who has services, make sure you're also connected to 988 so they can make referrals to you as well. So 988, besides all the languages they speak, they try and connect you to services. Now, if they can't, and they'll follow up with you like 2 or 3 days later, they'll do what they call a warm handoff. Well, they'll hand you off to a mobile crisis team if needed. So when you're going to a mobile crisis team through 988, we are obligated to get to you within 2 hours. But remember, we're not emergency. So 911 will get to you in 15 minutes. So if you're already on the roof, do not call me because I will not get there in time. The police, EMS will get there within 15 minutes or as quickly as they can. Mobile crisis team through 988, we have 2 hours. We're not obligated. It is a recommendation. So our goal is to do that. Sometimes we can't make it, but we do our best, or we will call you and say, we're running late. We are on our way. We are coming. Internal referrals, we have 24 to 48 hours to get to you. So that's the difference. Now, once mobile crisis team is, we are a short-term service. We are a linkage to service. Those other teams I mentioned, the intensive mobile team and the ACT teams, are longer-term mobile teams. They will work with you for 1 to 2 to 3 years to keep you stable in the community. All of our goals are to not bring you into the hospital. The whole reason mobile crisis teams exist is to try and prevent hospitalizations, to try and prevent police coming into the home. But if we do have to call 911, we will call 911, and EMS and NYPD will show up. NYPD will handcuff you if necessary, but obviously this is just for safety of the ambulance crew. It's not for anything else, and you are unhandcuffed, so it's not, anyone who's concerned about ICE or anything like that does not play a role at all. Our mobile crisis team, you will not receive a copay. We will not charge you for our services. If you have insurance, great. If you don't have insurance, that is fine also, because we're grant funded to help fund the services through the city and state. We're both city and state. OMH and DOHMH cover us. Sorry, OMH, Office for Mental Health. DOHMH is Department for Mental Health for the city. So those are the two services. When we come to your house, Brookdale's team, most teams in Brooklyn, there are 4 teams in Brooklyn. There's Woodhull, which covers the north. There's Kings County that covers the middle. There's VNS Brooklyn, which covers southwest. I should have brought a map. And we cover east. We cover the OBH area. So Interfaith, Brookdale, and Kings County area is our catchment area. So we try to make sure we see people within our catchment area. It just makes better for linkages. So we do appropriate linkages. So we come out in unmarked vehicles. We do drive-bys. We don't announce that we're coming by. Yes, we're trying to catch you, but for a reason, because most people don't want to see us. It was funny when you say, maybe Dr. Nichols. I'm like, you don't want to see Dr. Nichols. If I'm coming to you, it's because something's wrong. So you don't want to see me. You want to see Miss Sonia and Dr. Olapana. That's who you want to see. If you see me, it's because, someone's concerned about you. So, we come, we introduce ourselves. We now are mandated to have peers. The CPEP as well, the psychiatric ED at Brookdale, as well as Brookdale Mobile Crisis Team, or all the teams in Brooklyn, I should say, have peers. Peers are people with lived experience who've gone through an intensive training of 3 to 6 months, even with an internship, of either substance use, mental illness, or the combination of both. They have youth peers as well for people, I think it's under 21 or 18. They have family peers who specialize, and then they have mental health and substance use peers. So we have, we had 2. Right now we have 1 peer. So we're looking for a peer, if you know who's completed the training. They go out into the community with us as well as the peers in the CPEP. They would go in the community and they do follow-up calls with people to try and re-engage people, to try and get them connected to services, to try and show them that, with consistency in treatment, whether it is or without medication, but going to your clinics will support you in continuing doing whatever you want to do in this world. Study, work, whatever it is you choose you want to do. So we're a short-term service. We will knock on your door. We will come in. We will speak to you. We evaluate you, and we will connect you to treatment. That is our only goals as mobile crisis teams. ACT teams, co-response teams are pretty much the same. It's 2 police officers and social worker. Be Heard is 2 EMS or paramedics and a social worker, and they come in a big blue ambulance that they can't transport. And then ACT teams are much larger teams. They have psychiatrists and nurse practitioners and occupational therapists. They have a whole group that visits you several times during the months. And IMT teams, intensive mobile teams, are those who frequent flyer through forensics, inpatient units, and the shelter system. If you're unfortunately and you're using those 3 systems to keep your life going, then you might be able to join the intensive mobile teams. Hope I answered
No,
any questions that come
you
up.
gave us a lot. You gave us a lot. Before I have Dr. Olapuna speak about the 988, Sonia, I wanted to ask you in terms of with the services that you provide for mental health counseling. Are you through the 988 system, or how are people able to get contact with you, and what do you use in terms of if you need to do any other type of referrals?
Well, I'm not through the 988 because I'm in private practice. So generally, my clients find me through their insurance. Most of them will find me through their insurance, and then also now a lot of referrals, personal people that will refer me. If I have to refer outside, absolutely, I would use 988 when necessary and collaborate because I am a heavy believer in collaborations for a person's total mental well-being because sometimes therapy is as wonderful as it is. Other practitioners are needed. So usually because I am in private practice, I have certain relationships I've built with other providers, not just therapists, but also not medical doctors, GYNs, different doctors. And so I have larger conversations with my clients when it comes to their well-being and will work with them or even encourage them if they're not seeing the providers that they need, especially when their health issues or anything else is going to affect their mental health. But yes, I will use those services if necessary. But generally, when people find me, it is through their insurance. And also, I'm a clinician with PAPA, which is with the NYPD. So a lot of my clients also are police officers because PAPA stands for Police Officers Providing Peer Assistance. And so those are peer-led police officers and mental health providers that work together in the program. So a lot of my referrals are from through PAPA as well as through insurance companies.
Thank you so much. And Dr. Olapona?
Yeah, with 988, it's an additional resource that we often give our patients, and also we just want people to be aware of. You call it if you're in crisis, you need to talk to someone, you're going through some difficulties, and you need to speak with someone urgently, or you're having some sort of crisis, particularly with things like suicidal ideation, things like that. You make the phone call, and within a few minutes, a counselor will come on the line within maybe 3 to 5 minutes max, and this is 24/7, and that's huge. And this is it. It started July 20. I think they said July 2022. Last year alone, they said they got 8 million calls that came in, whether through chat or text, and it's national. So I think it's a good adjunct service for anyone that's going through a emotional crisis and they need to speak with someone immediately. That's where the 988 number comes in. So we suggest it as an adjunct for our patients. And I've had a patient where she couldn't get a hold of me and she was in crisis. So she called the 988, and I found out afterwards that she had used it, and I thought it was a good resource for her to have access to. Mhm.
Absolutely, absolutely, especially
Just
when
to
it's in the middle
quickly
of the
add,
night.
because some people might not realize 988 was NYC Well. So if you remember that name, they're one and the same. NYC Well 988 became NYC Well became 988. Just to
Thank you
help
so
people know.
much. Yeah, no, definitely with that clarity. And you also said something, Dr. Nichols, as well, in terms of that 988 is a 2 hour, up to a 2 hour process if you call. If you are in immediate distress, 911 is the best number to call. And the beauty part about this is also is that we have professionals that are working with NYPD to identify and make sure that if they do come to a site, that they know what to identify. Because I know a lot of people are also scared about that. So, definitely work with elected officials and, with our practitioners and what we're doing. All we are concerned about is the well-being of patients that we are dealing with the community that we're dealing with. So, well, I just wanted to make that clear that, if you're in immediate distress, do not call 988, call 911. Thank you so much, Dr. Nichols, for making that clarity on that. Another thing I wanted to just touch on, our mobile crisis unit has both adult and child. You mentioned something, Dr. Nichols, that, the schools. So we go into the schools. How does that
We don't. We don't.
We
Our
don't.
team doesn't.
Okay.
Only those referred through 988. That's a specialized child team. They're allowed into the school. we can only go to the home. But the school teams, because I guess in parent absentia, meaning the parents are not available, the school is the parent, they're responsible for the child, so they give permission to the to the child mobile crisis team to go into the school and evaluate the child. Yes, so
Okay.
they'll work
And
with the child in the school and then at the home with the
right.
parents.
And I also know that we also get calls from schools in terms of if any of the
Yes.
children come. So just want to let you guys know that One Brooklyn Health does have a pediatric mental health division, emergency room division, as well as our CPAP. Again, knowledge is information. A lot of people don't know about 988. You know, I go out into the community a lot, and people are like, "What is 988?" I definitely want to give a big shout out to Assembly Member Monique Waterman, who was really pushing this initiative with the 988 and the mental health. Also, Assembly Member Nikki Lucas. They're really, really pushing, and all of our elected officials. But I know that they're working closely with us to make sure that there's funding in the community to make sure that we are handling our community properly. Because again, our community is not healthy if we do not help. Um, anything else in reference to about 988 or the mobile crisis unit? I'm just putting that up to anyone that you wanted to touch on.
I do community presentations if needed about mobile crisis team and like the other
Yeah,
teams that I mentioned, if anyone needs, or if you ever have questions, if you can call 988 to see if it's an appropriate referral or not, or you could call us directly and then we redirect you to 988 to see if it's an appropriate referral for mobile crisis teams. So
yeah.
that's perfectly fine.
And you can always go to our website, onebrooklynhealth.org, and you can just send us a message and it will come to both my department as well as the marketing department, external affairs and marketing. And we will be able to get in contact with Dr. Nichols. And I will definitely put all of our websites in the chat box at the end. And we're coming down to the last couple of minutes before we go into Q&A. So I want to ask each one of our panelists this question. And we're actually going to start off with Elliot. From your professional and lived experience, what is one key message, tool, or action step you would leave the audience with to help them maintain a healthier mental health lifestyle?
Mm-hmm. Yeah, I mean, I'm going to use, a word that I've been working overtime, and I'm going to put it back on the table again. It's clarity. Again, it's so much information that we're getting from all of the panelists here, but it's very important for us to have clarity about how do we apply that to each other, to our individual selves. In my work, I have the mental conditioning gym. We do one-on-one training and we do group training. And a lot of what happens is I don't call them clients, I call them fighters, because I'm a big boxing guy. And I believe that life is about boxing. Life is truly that analogy. And we are fighters of life. And a lot of times when the fighters, they come in and we're mentally sparring, we're mentally training, really the biggest issue is just clarity. All of these symptoms and things that the doctor's talking about and Sonia's talking about, it's how do I say this? It's really a prerequisite that we're not understanding. A lot of times people, they're talking to me, but they're not really understanding that I need to go see a doctor. So that's the clarity that I try to, bring to people to say, what, I'm not that step, but I have to at least get you to understand that there's something going on. Somebody put in the chat about, if somebody's that one of their issues is they don't understand self-evaluation, but that's a step too. I have to make sure that you have clarity that I'm unable to do self-evaluation. But many of us are functioning not knowing that I can't self-evaluate to know that there's something wrong. Something is going on with me. I have trauma, but I don't identify that that is something that's an issue, that trauma is causing me to act the way that I'm acting. And so for me, the biggest word that I want everybody to really, really kind of leave here with is understanding that clarity is very important to what our mindset. So I will leave you with that same assignment. I'm sitting, I'm standing, I'm laying where I am because of my mindset. When you have that and you have clarity about, wow, let me see exactly where it is that I'm standing in my life. So that's what I would give to people going forward, to think about it in that way. And that will put you in a position to where you can at least identify your clarity is just not there. I say that mental conditioning is not positive thinking, It's not negative thinking, it's reality-based thinking, that I have to be clear about where I'm sitting, where I'm standing, or where I'm laying in my life.
Thank you so much, Elliot. And Sonia?
The concept I want everyone to understand is that mental wellness is a lifestyle. One of the things that I talk so much to my clients about is not only just the symptoms that they're presenting, is I look at their entire lifestyle and looking at all of the components that require health that people a lot of times downplay. So my training is extensive in integrative and functional psychiatry. So I'm looking at how you're living, what you're eating, how you're sleeping, what kind of movement you're getting. All of these things are so important because 1 hour with me every week or every other week is not going to be enough if you're not sleeping, if you're eating foods that are causing inflammation, if you're not going to see your doctor like you're supposed to, if you're not taking your diabetic medication like you should, if you're not doing all of those things that are necessary, if you're not getting any movement, if you're sitting down all day long, you're never standing up and get a movement, if you're indoors, if you happen to work at home and you don't go outside, and especially for people of color, you're not going outside, so you're not getting any sunlight. Guess what? You're not getting the highest concentration of vitamin D, and then now you're more depressed. All of these things, I look at mental wellness is a lifestyle, and so getting people to have habits, healthy habits that are scientifically based for mental health, is very, very important. Drinking enough water, eating enough greens, all of those things, believe it or not, have an impact on whether you see me for depression, anxiety. If you're dealing with someone with bipolar, schizophrenic, believe it or not, all of those things matter. So again, the concept that I constantly teach clients is mental wellness is a lifestyle, and the lifestyle practices that you need are going to be very important for your mental well-being.
Mm-hmm.
Thank you so much. Dr. Olapuna?
One thing I would say is that if you are suspicious that you have a problem, is to seek a mental health provider. There are people who are trained to provide these services, and a lot of our treatments are very effective. So there's no reason to suffer in silence. Just like if you have something going on with your physical health, I think we all know to go see a primary care provider. If we have, high blood pressure or diabetes, or symptoms that we can understand physically. The same thing happens with mental health. If there is something going on with you emotionally, you don't understand, you're struggling, you're having challenges, there are mental health providers. And at different levels, there's social workers, psychologists, psychiatrists, a lot of people who've been clinically trained, licensed to provide mental health services. So I will just encourage folks to go get help if they're suspicious of themselves or someone in their family, someone that they know that needs help, and to normalize going to see someone.
Hey, Dr. Nichols.
Just jumping off of what everyone is saying, but adding to it, because Dr. Olapana was saying, like, there's the whole stigma about not willing to request help, and that's at multi levels. That's public level, that's your self-belief or familial belief system around mental illness. And then there's the institutional systemic belief around mental illness. Even though we are trying to grow and improve, there still is a lot of rigidity around it. So sometimes that might block you. We always give the example, when someone's missing a leg, we can see it. Well, we all still have our heads attached. We cannot see the mental illness per se, except for some of the symptomology that might be obvious to everyone. So, as we combat that, please, I mean, even if it's a wrong choice, it sometimes never hurts to talk to anyone. I mean, one of the things I give out, I keep showing you guys things you can't really see, but the adverse childhood experience, there's a questionnaire in here for people to look at, especially like parents, to take the quiz to see, would you benefit from therapy? I tell people therapy can be just a tune-up. Maybe you just need to talk to someone who's outside of your immediate support group, outside of your friends, outside of your family. You don't have to be trained to support somebody, but sometimes you need that extra level of support that other people can't offer, or you're not willing to tell them everything. Well, that's fine. That's what the clinicians were paid to be there, to be supportive and help you. And then find that this is going to sound, whatever the term is now, new agey or positive, but try and laugh at least once a day. Try and laugh at yourself. I mean, who's the friend or parent or sibling that makes you crack up to your cheeks hurt? If you can't get it once a day, get it once a week. Just a good belly laugh will lift you right up. And what is the thing that makes you want to explore or challenge yourself? I've been to 152 countries. I want to get to all of the countries in the world. People like, how do you do it? It costs money. It does not cost money. I've stayed in $1 hotels and I've stayed in $500 hotels or something. It doesn't cost money. I've stayed in buses where your knees are up to here. But my goal was trying to visit things, to see things, to experience new things. So challenge yourself. Make life fun. It doesn't, I don't care how burdened we all are. We all have issues. Life is not easy, as Mr. Allen was saying, but it can be fun and silly and just let go. I know with patients, I've laughed with them sometimes. We just laugh. It's funny. You got to laugh sometimes, so there's nothing wrong to laugh at yourself, to laugh at mental illness, to be shocked by it, to challenge yourself, to have fun, because this world is flying by. And if you don't pay attention, time will go. So enjoy it. Go out there and take risks, healthy risks, to challenge yourself to do new things and explore.
Enjoy. Yes, I love it. Okay, so we have some questions for you guys. So the first one, I'm going into the chat box first, and then I will go to the Q&A box. So Chrissy David indicates, she says, love this level setting, Mr. Allen. Great prompts for checking in with ourselves on these core concepts. And we also have Christine Julian. She has a question for you, Elliot. How do you enforce the concept of mental conditioning when, for some individuals, the lack of self-awareness itself is a symptom of the mental illness?
Yeah, I saw that and I kind of addressed that because that was a very good question. That does happen. Where, when you come into the gym and we do training, one of the first things that we work on is self-evaluation. But I've had fighters that when as we're working, it just keeps blocking. It just keeps blocking because they're refusing to do their self-evaluation. But however, when you start making that attempt, that becomes obvious to them during that conversation. Like Dr. Nichols said, do you have that conversation with them? You kind of like, it's clear that you should be giving me some things towards your self-evaluation. And at that point, it may not be the clarity that you want, but that is clarity. I'm having trouble now self-evaluating. I can't do it. That's when I'll say, you know what? Now we know you're going to have to go on to another level. I can refer them to, Dr. Nichols. Dr. Nichols said she's not the one.
Well, it's okay.
That's a Sonia.
Right. It's going to be somebody else, but that is a very critical point because you're not going to be, it's just not a perfect world. You're not going to be able to do all of these things. You're going to have trouble with some of the 4 principles. That's okay. But the clarity behind it is that, I recognize this is where I'm having trouble. That way you can address what's going on. So that part is very important, and that's okay. If that's an issue, it's like the self-evaluation piece is just not, I'm unable to do that. That's fine. Now you need to get into that therapy. You need to see that professional clinical person that's going to be able to help you push through that. But we have identified that is an issue. And let me tell you something. That's the first principle. But people always ask which one is the most important. By this much, you probably can't even see the difference in my fingers. It is the most important part of the 4 principles. You have to be able to do your self-evaluation, to have excellent decision making, to be able to have a clear big picture, and to be able to stay the course.
Did anyone want to chime in with Christine's question? Okay. We have Shalise Dowdy. Please forgive me for mispronouncing your name, but they want to know, is Miss Davy licensed in New York only?
Yes. Right now, just in New York. Soon in other states, but right now, New York.
Okay. All right. Now we have Quanda Delandy. People ask me this all the time. Is AI chatbot an ethical, appropriate resource for addressing someone's mental health? I'm going to start with Dr. Olapuna, then Sonia, Dr. Nichols, and Elliot.
These platforms are out there now, and people are using it. A lot of people are using it. However, at this point, we do not have research on these services to see if they are giving us good outcomes for the treatment of the mental health disorders that we have, right? So I think obviously there's a lot of research that has started on them to see if they're effective, but we do not have like concrete evidence yet where I can say as a provider, licensed provider, that I know that this chat box will help you with your depression. I know that you logging onto the chat box a few hours a day will help you with your anxiety. We don't have that data yet. So I cannot endorse them at this point. The good news, though, is that there's a lot of research going on them because a lot of people, because a lot of people are using it. There's a lot of money being pumped into studying the effectiveness. I think we'll have the data in a couple of years, but we're not there yet. But they are heavily being used. What I'm telling my patients that are using it is, I don't want this to be a substitute to you coming to see a provider like myself. Like if you want to be using this platform, I will discourage you not to. But if you're going to use it, make sure you're discussing your experiences with a licensed provider and not just using it in isolation. Because what we find sometimes is that some of the language models, they tend to confirm what people are telling them.
Yes.
Can cause a lot of confusion. And it's not giving you multiple perspectives, and then people have different ideas that are coming from it. Um, and I had a friend who showed me their conversation. I was
Yes.
shocked, like
Yes.
a whole conversation without a person, and they were essentially saying, "Well, I had this conversation. They gave me as great advice as you could." And I
Yes.
was like, wow. And I
Yes.
looked at it, I was completely blown away,
Yeah.
right? Because some of the points were on there. But at this point, we don't have the research on it. So I wasn't going to endorse them to say, okay, keep using this, don't go find a therapist. This is good enough. Because I can't fully say that at this point, but this is just the beginning of it. We know that a lot of people are using it, particularly young people, because they find it more accessible. It's faster to use. They don't need to call a number, to come to see us. They don't need to call 988. They just go on their, chat GTP and type in their question, and they get all kinds of responses. But it's new, it's exciting, but I think we need to study it before we can say for sure that is appropriate way to get services.
Absolutely. It's like Dr. Google when you walk into and you tell your primary care, well, I went to Google about this, rash on my arm. You're like, oh my gosh, are you kidding me? So now they're doing it with mental health as well. So thank you so much. Sonia, did you want to chime in with that?
Absolutely. No. Chat will make you feel warm and fuzzy. And so, going to the point of Dr. Olakuna said, it's going to endorse what you're saying, regardless of how far off sometimes you may be. Now, I have had clients that have read to me. They said, "Well, I did say this, discuss this with Chat." I said, "Okay, what did Dr. Chat say?" And they will read to me the entire, conversation, the thread that went on. And someone actually did it last week, and as she was reading parts of it, I was like, okay. And then she got to one part. She said, "You're not going to agree with this." And she read. I said, "Absolutely not. I do not agree with that." So, and thankfully, she's aware that reading it to me, and it was something she was planning, well, seeking some information and then running it by me. But I don't think, like as you were saying, Dr. Lacone, there's not enough. They're pouring research into it, but we're not there yet. And I think also too, people are designed for human exchange. So there's just a level of what we need in terms of connecting with a professional human being, even whether it's doctors or mental health, we need that human exchange. And just relying on that, it's not healthy at all. Because like I said, it is going to tell you what you want to hear
Right.
continually. And that is not what happens a lot of times in therapy. You're not hearing always what you want to hear. You're hearing what you need to hear, and whether you like it or not. And so Chad is not going to do that. And I don't endorse it for therapy at all. They'd have to they got to do a lot more research.
Oh yeah, and the good thing about it is that at least if you have a therapist, they're reading it to you.
Right, right.
They're
That
not
part is,
just
yeah,
holding it to themselves. They're
exactly.
reading it to you. So
Yeah,
that's a
quite a few
plus
of them have
factor.
read it to me. Clients have read it and said, "Oh, over the weekend." I said, "All
Yes.
right, what did Chad say? Let's see." And again, there are a couple points. I'm like, "Okay, well, that part is okay. We've discussed," or usually I'm saying, "But didn't we discuss that? Or didn't I tell you that already?"
Right.
Okay. I said, "Yeah, you just had to hear from Chat, but no." No.
Yeah, exactly. Dr. Nichols, did you want to
Well,
chime in with
just to
that?
make you laugh, I mean, I agree with what everyone said. There was like a trend or something on Facebook where people were asking ChatGPT, to do a caricature of them and their job or something like that. Now, on my Facebook, I don't have my picture. I have something innocuous. But apparently, just from some of the conversations I've had with this thing, this is what I look like.
Oh,
Oh,
wow.
okay.
So I
Yeah,
didn't know I
yeah.
was a white male. I
Yeah,
didn't know I was
okay.
male. Clearly, I've been very ambiguous in my conversations enough that it did not realize I was a female, a black person. So be careful. I was like, wow.
Wow. Wow. That you want to know that's a good laugh. I hope everybody on here had their
Yeah.
laugh for today.
A resounding no.
A
Yeah.
resounding no.
Exactly.
Yeah.
So, but it is here to stay.
Hmm.
Everyone is using, AI in one way or another. I think the examples just shared before are important. Are we going to get rid of it? No, it's being used in electronic health records to help physicians and everyone to get notes typed. So there are some things with it. I think in conjunction with your clinician, because I can't think of everything, and if it does suggest something, let's explore it. Or why did this appeal to you? What aspect of this was helpful to you? So, if you're willing to work in conjunction, if you're relying on it solely, definitely not. I don't think there's enough information yet, and you could take you down a false path, and that's not healthy or your goal, because obviously you're seeking to get help for yourself and you want to improve things. So
Mhm.
don't cut yourself to spite your face by not wanting to speak to another human being who's been trained
Yes.
in the
Well,
field.
one
Absolutely.
other thing, there's also a case I think right now, maybe more than one, with a child that committed suicide because they were on chat and they were seeking chat for some advice, and again, chat endorsed what, I guess, their thoughts of ending their life. So again, that's why I said that chat can make you. I mean, I use chat for other things, so I'm not against
Right.
it. But as you were saying, Dr. Nichols, not solely, because it will make you feel warm and fuzzy on some things that you really need a professional lens on.
Absolutely. And Elliot?
Yeah, I just would say be very, very careful. Like the other panelists, I have seen a couple of chats and you're kind of like blown away, like what's going on here? But I think that the most important piece is to understand, and I go back again to self-evaluation. And sometimes, again, me included, I study this or I train on this ad nauseum, but sometimes even my self-evaluation is not quite clear. And so as you're typing that into ChatGPT and the conversation that I saw, it was profound because the information that they were chatting, putting in the chat was not accurate. And sometimes that's why we need a human being in front of us to say, hold on a second. I hear what you're telling me, but you need to be challenged on that. I think that's the key word here is challenged. And another human being can challenge what you're putting in, on in the chat. By keyboard, but you're putting it in chat in a conversation. I can challenge that. Dr. Nichols can challenge that. Dr. Olapona can challenge that, and Sonia can challenge that. Those are pieces that very, very important, because if you're putting into the chat the incorrect information, of course they're going to give you right back, what you want to hear, but you presented it in a way of how you want to hear it. So it's something we have to be extremely. I think that's a really big question, and I think, please, I would implore everyone to be very careful about that one. Very careful.
Absolutely. Our next question is, can you speak to the impact of generational trauma on mental health within the Black community and what can be done to address it? Um, Dr. Olapona, Sonia,
I,
Dr. Nichols?
all right, you go first, Doc. I got it.
Yes. So what we talk about in generational trauma is the idea that sometimes traumatic experience that people have in certain families can now be passed on to multiple generations, where people in the younger generations, two, three generations down the line, are displaying signs and symptoms of behavioral health issues, mental health issues that were often triggered by the impact of things that had happened to their forefathers. And in the science world, they actually believe that when there's been a lot of trauma, it actually changes the DNA of the individual involved. So, and then those DNA changes are now passed on to multiple generations down the line. So we have people then showing behavioral symptoms, ways of relating, belief system that are secondary to traumas that happen with people 2-3 generations down the line. And I think one of the ways we treat it is just for us to be aware that this is a phenomena that happens. Like if we're engaging in certain patterns, things that we're seeing, that's going on with a particular generation, and tracing it down the line to see where this could come from. Now, things like family therapy is very involved. If we still have people who are alive in the different generations, that could, be part of larger conversations about what has happened and the effect of it on the younger generation. And if someone also has traced that in their family lineage, there are particular things that is a consequence of what had happened to an ancestors, obviously going to their own individual therapist with a trauma-focused psychotherapist to process it would be very helpful.
Okay, and Sonia?
I agree, exactly. And there's so much with trauma. Trauma is very layered. And one of the jokes that I tell my clients is Black people just started going to therapy on Tuesday. So there's so much about trauma, about mental health that we're finally being forced to see. And there's also so much about trauma that it's just very layered. But one of the biggest challenges, because as Dr. Olapuna pointed out, the millennial generation really pushed the conversation of mental health in ways like never before, which was extremely needed. One of the biggest challenges I see in a lot of the clients I work with over the years is sometimes the biggest part of a child or of a child's mental health is an unhealed parent. And there are a lot of, because of the generational gap where the millennial generation and Gen Z and all the others, they are embracing therapy. Some of the parents from the previous generations are now open to therapy. So a lot of times I have to tell them, you're going to have to get your healing without your parents' permission, because they just may not want to get involved in therapy. But a lot of times even when I've dealt with the education system, and educators will talk to me about a child's behavior, and I would always question what's going on at home. Tell me what's going on at home. I know the child is acting out. Tell me what's going on at home. And 9 times out of 10, there is a lot of issue and trauma within the home that is just not going to be addressed. And so that's why at times I say a lot of times, especially for a lot of children, a young adults as well, sometimes the biggest challenge to their mental health is their unhealed parent. And so continuing these conversations on trauma, what it looks like when children are growing up in traumatic environments, if they're growing up in environments with parents where there's been domestic violence or substance use, just like what Dr. Lapuna said, if you have a parent there's a mom that's pregnant and she's going through a lot of trauma and stress, all those chemicals, all the cortisol, all of that, that baby's getting all of that. There's no screening that's stopping those high levels of cortisol from going to the baby. So the condition, the mental health of the mom, especially when she's pregnant, yes, we have all the other generational issues we have to look at in the DNA. Absolutely. She's 100% correct. And in addition to what is the condition of the mom? I've asked moms, clients that I work with, especially clients who have kids and they're having issues with their kids. I said, what condition were you in when you were pregnant? And it's so overwhelming when I have moms that'll say, oh, it was a lot of stress that was going on, or I was, I didn't get along with the child's father, or I was going with this and this. And I said, okay, so let's look at why your child may be acting out, because some of that might have happened in vitro, and then let's look at the household. What is the condition of the home? I worked with ACS cases for almost 8 years. And parents would come in the first session, they would complain about the child. I let them complain the first session. By the second session and on, we'd have to look at, here are the dynamics and the things that are happening with you, mom or dad, mom and dad, that have to be addressed. Your trauma was never dealt with. So because your trauma was never dealt with, now your children are impacted. Because if you're not healed, it will impact the way you show up as a parent. Those are tough conversations. A lot of times our parents don't want to hear, because in a Black community, we're not judging. No, we're not judging, but we're judging behavior. We're not judging your heart. So yes, we are going to judge the behavior of the parent, not to criticize them, but to look at the healing that they didn't get and how now you're not getting it. So the trauma conversation, generational trauma, I think we're at the tip of the iceberg with that, because that is a conversation that needs a lot of psychoeducation, a lot of individual therapy, and then a lot of family therapy.
Can I just add quickly? Sorry.
Yeah, really quick, because we got a lot of
we
questions.
Know through Holocaust research, they've shown through the Jewish community, a lot of the trauma And then Dr. Joyce DeGruy wrote about PTSD, post-traumatic slave disorder. She changed the stress to the word slave disorder, where she does talk about generational trauma and epigenetics and everything.
Yeah.
So that's just to throw out there for people to read. It's a very tiny book. It's easy to read.
Absolutely. If you could put that in the chat box, Dr. Nichols, that would be great. Just for time, we have literally 10 more minutes. So let's keep our answers to a minimal for the next set of questions, because I haven't even gotten to the Q&A part of it. So we're still in the chat. So we have Zethia here. She's from New Hope Family Church. She said, "Good afternoon, everyone. I love this. Very informative." Thank you so much, Zethia. We have Roxanne Monroe. We know that trauma is prevalent in our communities, and especially among our perinatal population, which you just mentioned, Sonia. Do any of our OBH clinics offer trauma-specific treatments, i.e. CPT, DBT, PE, EMDR, or CT-PVD? Or do you have information on where this is available in the community? Dr. Olapuna, Dr. Nichols?
So we have various social workers and psychologists at the clinic, and different providers have different expertise. Now, I don't have a specific list of individuals who are trained in like trauma-focused CBT and DBT. If someone is interested in working with our clinic, they should still come through our intake, and we will find the provider that's licensed to provide those services and connect them to that person. Mm-hmm. Now, if it's outside of the OBH system, if you go on Psychology Today and you type in any of those different treatment modalities, you'll find a list of providers that are trained in it if you're looking for someone outside of OBH. But if you're interested in OBH, I would say still come through our intake process, and then we will try to link you to, and we'll find the provider that has the skill set for the particular therapy that you're interested in, and then we'll link you with that person.
Okay, great. And that's Roxanne Monroe. She is the executive director for our Healthy Families at One Brooklyn Health. So Roxanne, definitely connect with Dr. Olapuna to get some of those resources for your clients in the Healthy Families program. We also have someone that just made a statement. As human beings, we need human connection to human connection, and seeking help from a computer and not a licensed professional is dangerous. People are already feeling more isolated due to social media. They then say, "Excellent panel and so much wonderful resources shared. Thank you all. Happy Black History Month." Excellent point, Sonia. Very well. And Dr. Nichols actually put in the chat box.
Actually, they can't see it. I can only send it to host and panelists, so you'll have to put it into the main chat.
Okay, so what I will do is I will cut and paste and make sure that we send this out in the email blast when we send the recording out for this. And then, yes, well said, Sonia. So let me go to the chat box. What are some of the signs that can help discern between over spiritualization and possible mental health issues?
So I'll take that one as well. So if someone is presenting in a way and that is not typical for that religious or spiritual community, especially someone with an expertise in that particular spiritual practice, then we start getting suspicious. One of the things we look for is a significant change in functioning, and both occupationally and socially, that's deviating from the norm of what's expected, and also change in behavior that's significantly different from what one would see in a spiritual crisis. Those are the symptoms that we would see. So, for example, if someone is saying they're depressed, but then they're spending the next, 10 hours or a whole day praying and fasting and not eating, and and talking in a way that's maybe disorganized, not linear, not logical, not focused, one may start getting suspicious that is this just, being sad and praying for help, but a 24-hour prayer session and you're now talking in a way that's not logical, that may be deviating from what we may see in a normal prayer session for someone that's praying against praying to help to heal their depression. So we look for deviation in behavior, deviation in functioning as some signs to look for. Also, if we're not sure, it's helpful sometimes to get a spiritual consultant, someone that knows that spiritual practice really, really well, that can say, hey, what this person is showing to you or what you're seeing in your office is not typical of someone that's in a spiritual crisis that I see, whether it's in my church or temple or mosque, that their behavior, the symptoms that you're seeing is a little bit atypical. So those are some signs that we often would look for.
That's good.
Okay, great. Next question is, in many instances, providers and care teams are not aware of the side effects of medications. But for example, in AOT, court-ordered treatment cases, there's usually the argument made that the benefits of the medication outweigh the risk of the side effects. Just wanted to add that, they just added that as a side note. And then the last question is, how do you know the difference between needing mental health support or medication, or simply figuring out a way to fix a problem within yourself?
Well, a thorough examination, assessment, and I mean thorough, is very necessary in making those decisions. And it's a collaborative decision, obviously, with the client and with the doctor. But I know I have spoken to clients for a long time, and they've either considered medication, and unfortunately, for a lot of them, I'll ask them, well, what kind of, tests were done? And usually there haven't been. So I'm a big proponent of helping clients to ask certain questions to make sure that they're getting fully tested, making sure a lot of things are looked at just to make sure that their body is getting the support that it needs. Because even if they do elect to use medication, they still need to make sure that other areas of their health are up to par, whether it's nutrients and all of that. If you're going to take an antidepressant, then you still need to have nutritional support that your body needs for the effectiveness of the medication. So just helping clients to make quality decisions about that is important.
It's good.
Okay. Wait a minute, I think we have one more question. Do we? Nope, that is it, everyone. Thank you so much. My panelists, thank you again for your expertise, your time, giving us some really great nuggets in terms of how to deal with our mental health, our mental conditioning in this day and age. We have some great resources. I put the information in the chat. You will get this recording. So if you had to jump off or if you want to share this with anyone, we will be sending this out on our email list. As well as putting it on our website and also on our social media. So once again, thank you so much for joining One Brooklyn Health on our Mental Health Matters panel discussion, Lunch and Learn. Look for us for next week, Wednesday. We will have our heart-to-heart conversation, Lunch and Learn conversation. It will be on Wednesday, not next week, Monday. Monday is a holiday. So we will be here next week, Wednesday, the 18th at noon. Thank you again, everyone, and look forward to seeing you, and enjoy the rest of your day and week.
Thank you.
Thank you.